Berberine versus metformin. One is a prescription drug your doctor hands you. The other grows in a plant. And studies show they lower blood sugar at almost the exact same rate. So which one is actually better for you? And can you take both? That's exactly what we're breaking down today. And I'm going to give you the science straight, no fluff. And if you want to know the exact protocol for taking Berberine to lower your blood sugar, comment the word protocol below and I'll send it straight to you. Hi, I'm Diana. I'm a registered dietitian, a certified diabetes care and education specialist, and I have my master's in nutrition science. I work with people with prediabetes and type 2 diabetes every single day, and this question, Berberine or metformin, comes up constantly. So let's settle it once and for all. First, let's make sure we're on the same page about what we're even comparing here. Metformin is a pharmaceutical drug. It's been around since the 1950s. It's the most prescribed diabetes medication in the world, and for good reason. It works and it's very safe. Your doctor prescribes it to help your body use insulin more effectively and to stop your liver from dumping too much glucose into your bloodstream. Berberine is a natural compound found in plants like barberry and golden seal. It's been used in traditional Chinese medicine for thousands of years. But here's what's exciting. Modern science is now catching up and showing us exactly why it works, and the results are honestly impressive. These two are not in the same category on paper. One is a drug and one is a supplement. But when researchers start putting them head to head in clinical trials, something very surprising happened. So let's talk about what the studies actually show, because this is where it gets really interesting. In a direct head-to-head clinical trial, researchers compared Berberine and metformin in people with newly diagnosed type 2 diabetes over 13 weeks. And what did they find? Berberine and metformin produced nearly identical reductions in A1C, fasting blood sugar, and post-meal blood sugar. Nearly identical. And it wasn't just one study, multiple meta-analysis, which are large reviews that pull together data from many different studies, consistently found no significant difference in blood sugar lowering between Berberine and metformin when used alone. Now here's the speed question you came here for. How fast does each one work? In one trial, Berberine started lowering fasting and post-meal blood sugar within the first week. Metformin also showed a very similar timeline. So the honest answer is neither one is dramatically faster than the other. They both start working within days to weeks. But here's the nuance. Metformin may be slightly stronger at standard doses in some analysis. So if your doctor has you on metformin, that's not something to dismiss. It's a well-studied, effective, and safe medication. What Berberine brings to the table, though, is something also worth paying attention to. Here's where Berberine starts to pull ahead in a few specific areas. Number one, cholesterol and triglycerides. In the same head-to-head trial, by week 13, triglycerides and total cholesterol in the Berberine group had decreased significantly more than in the metformin group. That's a big deal because people with type 2 diabetes are already at a higher risk for heart disease. Berberine is essentially doing double duty. It's helping your blood sugar and your lipid profile at the same time. Number two, side effects. This is a big one. Metformin is well known for causing GI issues, nausea, diarrhea, stomach cramping. In studies comparing the two directly, GI upset occurred in about 30% of people taking metformin versus only 20% of people taking Berberine. Berberine can still cause some digestive discomfort in some people, especially if you start too fast, but it tends to be milder and more shorter lived. Over time, metformin can also deplete your vitamin B12 levels, while Berberine doesn't. And lastly, insulin sensitivity. Both improve insulin sensitivity, but Berberine does it slightly differently. Both improve insulin sensitivity through a specific pathway called AMPK activation. Think of AMPK as your body's master metabolic switch. When that switch is on, your muscle cells become more responsive to insulin. Your liver processes glucose more efficiently, and your fat cells start burning energy instead of storing it. Metformin works primarily in the liver, reducing your liver's glucose output and increasing insulin sensitivity. Berberine acts on AMPK, but also has distinct antimicrobial, anti-inflammatory, and antioxidant effects. It is also thought to improve your gut microbiome, which also improves insulin sensitivity. Okay, so here's where I want to be very clear with you because this is the most important part of this whole video. The question isn't really Berberine or metformin. The real answer is Berberine and metformin. Studies show that combining Berberine with metformin leads to greater reductions in fasting blood sugar, post-meal blood sugar, A1C, and insulin resistance compared to metformin by itself. Think of it like this. Metformin is already doing its job. Berberine comes in and works through slightly different pathways. So together they cover more ground. But I need to say this clearly. Please do not stop taking your medication without talking to your doctor first. If your doctor has prescribed metformin, that prescription exists for a reason. What I'm saying is that berberine may be a powerful tool to add alongside it, but always please have that conversation with your healthcare provider before making any sort of changes or incorporating any supplement, always. Now I want to share something with you because I think this is more powerful than any study I could cite. We got this review from, I'll call her KJ, back in June, and it stopped me in my tracks. KJ wrote, I never write reviews, but felt like I had to. I started taking berberine when my A1C was 9.3%. I was feeling super tired all the time and just didn't know what to do anymore. I started taking it, and within 2 to 3 weeks, I saw my numbers coming down. I didn't expect it to work that fast. I also learned so much, like how to build meals right, walking after eating, stuff no one ever told me before. Now, a few months later, my A1C is at 5.9%. Now, I'm not saying it's some magic here, but it definitely worked for me. Okay, an A1C of 9.3 down to 5.9. That is not a small shift. That is life-changing. And what KJ said at the end is exactly right. Berberine is a tool, right? But KJ also did the work, the walking after meals, the better food choices, the consistency. That combination is what moves the needle. And again, if you want the exact berberine protocol we recommend, the dosage, the timing, the food recommendations, exercise, all of it, just comment protocol below and we'll send it to you for free. But let me give you some of the foundation right here because I want you to walk away with something actionable. The research shows that 1,000 to 1,500 milligrams of berberine per day is the effective range. We recommend splitting that into 2 doses, so about 600 milligrams in the morning with food and 600 milligrams in the evening with food. Taking it with food is important. It helps with absorption and it reduces the chances of any stomach discomfort. You also want to make sure you're taking berberine HCl. That stands for hydrochloride. This is the specific form used in all the major clinical trials. Not all berberines are the same, and the form and dose matter more than most people realize. And one more thing, berberine is not a replacement for lifestyle changes. The people who see the best results are the ones pairing it with things like post-meal walks, high fiber intake, resistance training, etc. The supplement amplifies what you're already doing. It doesn't replace it. And just really quick but important, berberine is not for everyone without medical guidance. If you are pregnant or breastfeeding, do not take berberine. If you are on blood thinning medications or immunosuppressants, definitely talk to your doctor first. And if you're already on diabetes medications, including metformin or insulin, loop in your healthcare provider before adding berberine because it does lower blood sugar powerfully, and you want to make sure you're monitoring closely to avoid going too low. Berberine is a powerful compound, so treat it that way. So before we go, let's just bring it all together. Berberine and metformin lower blood sugar at a similar speed and with similar effectiveness. Metformin might have a slight edge in pure glucose control at higher doses. Berberine has an edge in cholesterol improvement and tends to cause fewer GI side effects. And when you combine the two, the research shows you get the best results than either one alone. The bottom line is berberine is not a replacement for your medication. It's a science-backed tool that can work alongside it. Talk to your doctor, be consistent, and pair it with the lifestyle habits that actually move the needle. If you want the full berberine protocol, exactly how much to take, when to take it, what to pair it with, what foods to eat, what exercises to do, comment protocol below and I'll get it to you right away. And if this video helped you in any way, please give it a thumbs up and make sure to subscribe to our channel if you haven't already done so. You've got this. I'll see you in our next video.